to welcome all of you to our 2 monthly class. First of all, thank you guys for spending your time with us because you want to learn for your pet. Today, there's this interview that ongoing for this pet emergency issue to the Chinese community. I really glad to tell you guys that you guys are, the pioneers in Malaysia that is doing this. They even go around, Southeast Asia, and not many people are actually, know about pet first aid, and really practice it, and even, get certified because of that. So congratulations, everyone. Now, why is this topic of out of breath? Okay, that's many times what we actually see in the clinic is just 2 days ago, someone came in because of the dog cannot be breathing properly. When we checked the dog, when we saw the blood, the PEC cell, that means the cell in the blood, left 6%. Normal blood is about 30 to 40%, 35 to 40%, okay? And no one even know that the dog has been not breathing properly, okay? Increase in the breathing pattern. So today, I actually put a lot of information in this class, okay? I know it's going to be very overwhelming, to be very, very frank. But when I want you to really pay attention, I'll tell you that this is the thing that you must know, all right? So the first 3 slides, when your concentration is the best, that is the things that I want you to know, because I want you to know that when is the time that your dogs get breathing difficulty, and actually how to see it, how to detect it. They won't even want to let you know, they are having breathing difficulty. All right. We have some videos and all that to show you. Then later on, I'll share with you 4 to 5 diseases about, how this breathing issue can come in. And then lastly, I'll tell you, how to actually calculate and monitor your pet's breathing. I think that I already kind of teach it during the heart disease class. But we have some of the new friends here, so we'll be sharing with you guys again, okay? Let's start. Are you guys ready? Ready? If you say ready, put a 99 for me, please. Right, let's start. Now, these few slides are going to be very, very important, okay? Generally, when your dog is breathing normally, it's when the chest is moving, okay? Tonight, when your dogs go to sleep, watch how they move. Mainly, it's the chest that is moving, okay? When you see the belly is also coming up and down, not like very little bit, like up and down, as how the chest is moving, every single breath, something is wrong with your dog, okay? Okay, that is what we call abdominal breathing, okay? Everyone talk about abdominal breathing, but how does it look like, okay? It's like the chest is going up, the tummy is also bloated up and down. If it's just up, down like that, it's kind of fine. If it's like bloated up and comes down and bloated and come down, that's something very wrong, okay? Second, the nostril flares open. They try so hard to actually even open up the nostril when they actually breathe, okay? That is also something not right, okay? And then another one I need you to pay attention is that they're breathing with an open mouth. Well, people like French bull and all that, they always breathe with open mouth, right? And sometimes panting. I think when Wendy has this experience before, where Disney is having this breathing when she is like having the so-called heat stroke like event. So the other day in Desa Park City, I actually see the same thing as well on the French bull. And the French bull tongue is already turning purple. And the owner didn't know about it. If I didn't stop her, give her the fan and reduce his heat, that French bull will be collapsing in half an hour for sure, because the tongue is already turning purple. Okay, and then when they are breathing, their front legs, right, is like sticking out from the body. They don't do this comfortable stuff. They just goes like, that means they are having difficulty in breathing. All right, we can share the next one. Right. So when you have any things that you want to ask, you can also start typing it in the chat. Yeah? Another one is when the neck and the head is moving forward, extended. It's good. When they are lying down, sometimes you won't see it because most of the time they're lying down and extend their neck, you know, with a little bit of open mouth. Okay. Sometimes later, I think there's another one who says, you see this lips where it goes when he's blowing out the air. Okay. Noisy breathing means like when you see that that kind of sound as well. Okay. And then another thing is rapid breathing. Rapid breathing means it's very fast. You know, in first aid, we call it tachypnea. Okay. Now, I want to ask you, what is a normal breathing? Not what is a normal breathing rate per minute? No price, but I want you to tell me. Okay. When sounds congested when it's breathing is that is sound congesting. Okay. Next. Great. Wow, only Christy answer me. No other people want to answer me. Okay. Let's see the next one. Great. All right. Coughing, we have many different kinds of coughing. Okay, so later on we'll tell you, you know, how does trachea collapse cough look like? How does the pneumonia cough look like? How does tenor cough looks like? I mean, sounds like. Okay, in the next few. Shallow breathing is usually shallow breathing always come with shallow and fast. Okay, one more time. That shallow breathing. Also something not right. Okay, when dog is like really sick, then they will have very slow and very shallow breathing. Okay, it's also bad. So, but shallow breathing for a normal sick dog, or you know, the dog that you want to detect, especially you know, your pet, it's always shallow and fast. All right. Whatever things that I'm telling you is not to observe after the activities. Not after you let him run for 2-3 rounds and then come in, oh, doctor, cham. This one is shallow breathing, fast some more. Wow, very bad idea. No, not like that. Okay, it's always when they are resting. All right, let's share the next one. Okay, so now any problem about how to detect your any one of the symptoms that you can see, or I explained just now that you do not know how to differentiate, then you can actually put it here. I'll demonstrate to you one more time. Okay. How about anxiety? Meaning when they're very scared, yeah, very scared, they will have shallow breathing. You're right. So that's why I'm saying, if you want to observe your dog, whether your dog is, you know, in this kind of situation or breathing, right? The first thing first is to see that whether in a way that they're resting. When they are having this, next step, what you're going to look at is the gum and the tongue. Okay, the gum and the tongue. Why? Because it's either they don't have enough oxygenation, you know, they will turn bluish, they will turn purplish, like, you know, in cases of heat strokes, or in cases of choking, or in cases of heart issue. Sometimes they turn purple or black. In cases of trachea collapse to, because they can't. So their tongue become purplish or even very purplish most of the time. In not so severe heat stroke, before they turn purple, they will turn very, very red. It's like bloodshot kind of red. Okay. Then you will know this fella is coming down with heat stroke. Then you do all your ways of cooling them down. Okay. Right. Reverse sneezing. Let's share with you about reverse sneezing. Okay, usually reverse sneezing is completely normal and harmless. Okay, reverse sneezing is, if for people who doesn't know, right, always think it's okay, it's asthma. So to them it's asthma. In Cantonese, allow me, you call Hei Chin. Okay, Hei Chin. Then reverse sneezing, they always do like that. Like that, like a pig trying to snot or like that. It's called reverse sneezing. Okay. Usually it's quite normal. Usually when they have a little bit of flu and all that, they will be having reverse sneezing. All right. But if keeps having this, meaning to say that something is irritating them, that's why they have this reverse sneezing. Okay, Daphne, when you and Chloe, your question, I'll try to answer a bit later, yeah? Okay. And so we will show you what real sneezing look like. Okay. Okay. Whose dog has reverse sneezing before? Okay. Next. Whose dog has reverse sneezing before? French Bull have it all the time. All right, Benji as well. Great. So usually what it does is, you imagine it's like our sneezing. So when there's irritants or having sinusitis, this is the thing that it will happen. Even mites, foreign body, when they go out to the grasses, right? Things that they irritates them or triggers the like us, triggers to sneeze, right? That is the way that they will have it. Sometimes some very long, narrow nasal passage will also having this issue. All right. Okay, but it doesn't mean that Shih Tzus and all that don't have it. So that's why you always see this in Pom. Pom always have reverse sneezing, even though they're very, very small. They actually have slightly longer nasal passage compared to others. Not like Shih Tzu and Pug and even French Bull, they are flat nose. Okay. Angjun, next, please. We have problem. Okay. So what you do is, when you see this happen, just massage the dog's throat, and also you can actually disturb their nostril like that a little bit, or blow some air into their face. Then usually it's fine. So sometimes if it happens very frequently, you know that some allergens is causing it, then we'll be giving them some antihistamine. Antihistamine like cetirizine, Piriton, things like that can be used. But all of these medication are very dosage sensitive. I really need you to know what is the dosage like before you actually buy from the pharmacy and start giving, okay? All right. So far, not punch, pinch, like that. This is the nostril, right? Two nostril, right? You just do like that. Or just touch like that. It's good enough. Then they will go like, or they sneeze one more time, then they will let go. All right? Can? Oh, okay. Trachea collapse. What is trachea collapse is that a normal trachea is like a ring, right? It's like a ring like that. The whole C ring is actually cartilage. Cartilage means something very hard, right? And then on top of that, there's this flexible muscle-like thingy. Okay, so when we say tracheal collapse, means this whole thing that has air. Look at the X-ray, right? The whole thing that has air, it looks like that big. When it collapses, it's like how it looks, the collapsed trachea. Okay, imagine the air, imagine water that goes through that pipe that is big, suddenly has to go into a smaller pipe and goes. So imagine someone has to actually, need the oxygen to breathe, but now the whole oxygen pipe is going smaller and they cannot breathe. So what they do, they open their mouth and it goes like and breathe like that. And when they breathe like that, they try to breathe like that, then they start to have a lot of irritation in the throat. Then they start to have what we call the honking cough. These honking cough are very similar to the honking cough as what you see in kennel cough, okay? I think we have a video for it as well. Let's share. Okay, most of the causes, it is really unknown, and I'm very sorry because people like Pom, Chihuahua are very prone to it. Some of the Shih Tzu is very prone to it as well. Okay, so it's usually a congenital issue, but because it doesn't have, the ring is not strong enough, that's why they are collapsing. I just want to share with you in overseas what the vet does is that they actually put a stand. Stand means imagine a coil, a steel coil. Steel coil. When we put inside, imagine this is the trachea. We put inside the trachea like a small thing, and then when we release, it just push up like a extend coil. Okay, when it extend, meaning to say that all the collapsing trachea will have this something like a net like thing to actually push it up, like a metal net. Imagine metal net to actually push it up. Okay, when it's being pushed up, the good thing is there's no more collapse because it's open up already. But the bad thing is the metal ring is there, which is the foreign body, and it cannot comes with like one ring, so it has to be like a tube. So the whole stretch of the trachea will actually have the metal net kind of thing. And the body is very smart. When there's something foreign there, what they do, they create a lot of mucus so that it actually push it out. So then this particular dog will need to have a long-term nebulization to reduce this irritation. Otherwise, this dog will be keep coughing. This dog will be keep coughing. All right. Overweight can be one of the predisposing factor, but it's not really the factor that actually caused the tracheal collapse. Okay. Right. Let's see. So see, the first one is like like that. In a very serious tracheal collapse, not only he will go like like that, right? It actually will start having problem breathing. And he goes like that. So he try to open his mouth, he will have open mouth breathing, panting with the mouth open. All right. So what we need to do is one of the reasons how it actually stimulate it happens even more is the irritation in the air. So allergen and all that will be one of it. Second part of it is actually having the no pull collar. So the choking chain, I don't know whether, well, I think in your generation don't really use choking chain anymore. The harness like this is perfect, which I see all of you are using. But the pull harness, the choking chain people used to train dogs and all that, we really discourage it because every time when they want to control the dog, right, they just choke them. And when they choke them, they actually press on the trachea and let go. press on the trachea and let go. Sometimes it's so bad that I have 2 incidents that when the owner used the choking chain, there are 2 types of choking chain. One is the round one, which easily release. Please use that one if you really need to. Otherwise, please don't use. I don't encourage it at all. And the other type is the squarish type of choke chain. And the squarish type of choke chain is the one that sometimes get choked and didn't let go easily. And once that happened, it actually choked them. And when it's really pressed on it, therefrom, when they come to us, we can't do anything anymore. We can use some cough medication, right? Not really to solve the problem, even though I write here solution. But when they have this problem, they always wanted to relieve it with some cough syrup. Okay. It can be done, especially when they have trachea collapse. Sometimes we use medication like steroid. Steroid is one of the medication that we use in trachea collapse, right? If you do have trachea collapse, if your dog do have trachea collapse, even though how much you hate steroid, right? Don't worry if your doctor need to give steroid for that few days. Okay, a little bit of steroid really doesn't cause problem, because if you don't let them have it and we don't have any surgical intervention to do it right away, right, the dog might die. So let them use the steroid at least for that few days, and then they will probably taper it down when the condition is a little bit more stable. All right, so you can follow? Can you follow? If can, 99. Kobe is on Nulin, yes. Nulin is a bronchodilator. Okay, Nulin is a bronchodilator. Usually, we'll combine bronchodilator and steroid, and then after that, we'll slowly taper off the steroid and keep them on bronchodilator. And sometimes we don't even really need the bronchodilator anymore. Sometimes we just need a little bit of antihistamine. That's all. All right. Yeah, some of the big dog trainer, they use choke chain. Okay, so you can. Long-term medication really depends on how bad the trachea collapse relapses. If it's under control, we usually keep it that way and taper it down. Once we taper down to certain doses, right, and it doesn't really help anymore, then we'll have to increase back the dosage, right? Great. Next, kennel cough. I don't know whether you guys are familiar with this kennel cough, but kennel cough, it's also called the goose honking cough. All right. In Cantonese, I think I just learned like a few years ago that this cough is called pak yet cut. That means you cough for 100 days. All right. So this is actually a tracheobronchitis. Trachea means trachea lah, the straight one, 支气管. Okay. And then bronchus is the one that is branches out. Tracheobronchitis, just to tell you that is the bacteria, it's infecting this big one, the trachea, and then the branches. That's all. Well, it just give a very famous, so-called power name. But anyway, it just means like that. Bordetella bronchoseptica is actually the bacteria name that responsible for this disease. Usually, sometimes they also have, because of other viral diseases like herpes virus, influenza virus, because of that little bit of immune suppressors from the viruses, then kennel cough start to come in. Sometimes it's because of other dog has kennel cough. It's very, very easily transmissible. So that's why why is it called kennel cough? Because most of the dog caught it from the kennel. It's like one dog has it, then the other dog go for boarding and all that. I'm sure you heard about it. They go for boarding and then they come back, with the kennel cough. And usually the doctor will use 2 different antibiotics to take care of this kennel cough. And most of the time, it can be actually, be as long as 2 to 3 weeks of medication. Okay. Sometimes it's even like a month of medication. Okay. Right. Next. So kennel cough has one big thing that I think everybody will talk about later. right? Let's see how kennel cough sounds. You hear the goose honking? Can you repeat it one more time, Huang Yun? You see the this is very soft, all right? And then he get like that. Okay. So sometimes when they cough, you see when he sits down, he'll be doing that jerk. I purposely want to show you this jerk. Yeah, he vomit out something. But did you notice the abdomen movement? The abdominal movement? Before he actually add back his vomiters. The abdominal movement before he do the real cough. So when you see your dog, right, sleeping and suddenly doing this, meaning he actually want to cough. All right. And usually it's very persistent cough, okay? It always happen on morning, evening, night time. It happens all the time, okay? And then like something is stuck in their throat. Yes, how does the kennel cough pass to another dog? Very good question. Just by being together with them in the same room will pass to another dog. That bad because whatever that is coughing throughout, like the droplets that coughing out, those are the one that it's going to be contagious to other dogs. So you don't really have to touch it. So that dog is like coughing there, and your dog just walk over. That's all. Even like staying next to each other will be having that as well, because the droplets is having the bacteria. And then when they dry up, the wind blow and all that, you have it as well. So now this is the airborne, you're right. Okay. So yeah, this slide will actually answer all your question. Okay. So usually in a very big like a kennel, or even when you go for gathering and all that, this one goes to people that likes to go for gathering. It's good that I always see the POM group, right, that they limit to certain number of people who can actually goes into like that one function room or things like that. Last time I think I joined them for one of the event. We noticed that they always have some free space, not like overcrowded with pets. Even though they have so many members, right? I think that's something good that I need to praise them for. So whatever it is, it's good to have gathering, it's good to come together and all that. Always make sure you take care of your own pet. You can sanitize them before, after, and then you generally it's those people. Another thing that I really need to tell you guys, it's just like having COVID, right? When your dog is not well, when you heard your dog coughing, you suspect it could be this, or even not really suspecting it could be this, don't bring to the gathering, right? Just don't bring to the gathering knowing that your dog is not well, all right? It will also cause stress to your dog to have, poor recovery as well, okay? Kennel and shelter, co-environment, it's a predisposing factor. It's not a predisposing factor as in the dust and cigarette stress and all that. The transmission is definitely the inhaling of the bacteria, so it's airborne. All right. All of this overcrowded ventilation and all that is just predisposing factor, right? I guess you guys can understand. All right. how to prevent it, because it's highly, highly contagious. So please keep away from other dogs. If you know that your dog is coughing, don't go for any gathering. Don't go for the pet show and all whatnot, okay? Usually we use combinations of antibiotic. Usually we give a very, very long time, minimum 2 to 3 weeks, okay? And usually they won't stop coughing for the first 1 whole week, and every single night you'll hear coughing, even though you start giving medication. So usually the owners will come to us like, wow, the other doctor give the whole week of medication, is still not getting better. First of all, it could be the doctor giving only one medication, thinking it's a normal cough. Then it later on come to see us, oh, okay, has better sound of the kennel cough. Then we pick it up. Or it's actually because the owner can't tahan, because even with the medication, with a little bit of what is this? Reduce in cough, you won't know, because you just know that you can't sleep because he's not sleeping. All right. So avoid from going on overcrowded or poor ventilated area. Vaccination, there is a vaccination for it. Very sad that there are people also going to the black market to actually do this. You don't really have to go to black market. Kennel cough is a vaccine that you can actually get from your normal vet. But the only issue is that sometimes the kennel cough vaccine cause some injection site reaction. That means swelling and whatnot lah. All right. And we definitely can use the immune booster like Straf, any immune booster to actually reduce the chance of them getting affected. All right, going for grooming as well, you can, but most of the time I think grooming won't really like let them run around. So if your dog is not well, also don't send for grooming lah. Okay, and I want to tell you guys something. Most of the people, right, is so, I think it's just human. Pay attention to this. I really want you to know this. A lot of people, when they go to the vet, right, they want the pet to look good to go to the vet. It's a very, very wrong thing to do, okay? If your dog looks matted, ugly looking, if he's coughing, do not send to the groomer first before you send to the vet. Especially, sometimes even a very old dog, because their hair are matted, because they lie down most of the time, they don't groom themselves anymore after a week. So hair all entangled. Then because the owner want to look good in front of the vet, then they send them to the groomer to wash and untangle all of that. They come to us, it's really like the dog is actually probably having heart problem already, like not breathing very well. You send them to the groomer. Even kennel cough, coughing, but my dog so dirty, later my pet to know what she. Do not do that. Just go there. Because, if it says that, like, if you need to shave them, then we will tell you that we need to shave them. If ugly, never mind, you can grow back one, right? All of this, no chance, okay? So please don't try to look good to with your pet. If it is coughing, don't send to the groomer first. Go straight to your pet, okay? Kennel cough vaccine can be taken yearly for sure. But if there's no need, let's say your dog always in at home, go for kai only outdoor, don't really go for boarding and all that, then you don't really need the kennel cough vaccine. All right. Okay, next. Kennel cough cannot pass to human. It's not a zoonotic disease. Right. Still can follow. I can still continue. I try to make it on time. All right. Okay. Pneumonia, very simple, very simple way of explaining it. It's just the inflammation of the air sac. That means infection of the lung. Okay, it can be viral, bacteria, protozoa, even parasite, or from the inhalation irritants. Okay, right. Next. So usually what they do is, because pneumonia is an infection, most of the time they will feel very much more, they look much more sick than your trachea collapse dog, than your kennel cough dog and all that. Kennel cough and all that, they still walk around happily because they don't really have fever that much. They just coughing very badly, like they want to die, like coughing like an old man, like coughing their lung out. But in pneumonia, they will feel very sick. Most of the time, they even, the capacity of the lung is so little that they need to use the open mouth breathing method or the blowing of lips method, like I told you just now. Sometimes you see them breathing, right? The lips is blowing, the lips up here, right? It's like that is something not right. Okay. Usually the loss of appetite because of the infection. And then because the lung capacity is not good enough, what they do, they use the abdomen to help. So just now I told you, the abdomen will go up, like really bloated, and then go. If you see like the normal up and down, it's not really a problem. But imagine is whatever the normal things that's supposed to work, the lung don't work. So the abdomen is trying to expand and blow up like a balloon to help with the ventilation. Okay. Sometimes if they have also upper respiratory tract disease with the pneumonia, they will also have discharge. They have wheezing because of the bronchitis, like the bronchus and the small pipes or the tube are becoming smaller. Why they are becoming smaller? It's either because they are getting irritation or because they're inflamed. Okay, imagine when they're inflamed, it's like they inflame outside and inside as well. So the hole from inside is getting narrower or smaller because of the inflammation of the wall. Okay, and they have fever. Okay, only honking or wheezing in the morning consider tracheal collapse. It can be because the trachea collapse, right? It can happen, in certain time and not in the other. I'm sorry, Lim. I'll probably answer you a bit later on this. Let's finish up with pneumonia first. Now, how we actually treat pneumonia is that usually we'll try to find the root cause. So the vet will usually take an x-ray to see what it is. Usually you see how bad the lung is lah. Okay, when you have pneumonia, we just want to see how bad the lung is. And pneumonia, to be very frank, it's a bit difficult, from the x-ray to differentiate from pulmonary edema, the one that I want to tell you later, the one that lung is filled with water. It's a bit difficult because it's so inflamed and so much of mucus, right? It actually appears like there's a lot of water around it as well. Okay, so when your vet tell you that, yeah, I don't know whether it's a pneumonia or water in the lung, 我唔知肺入水定係肺炎。Then you say, what lah, this doctor like that also don't know. Well, this doctor no good. It's not like that. It's really because from the x-ray, right, it does look the same, almost similar. Okay, so it's not a problem. Usually depends on other symptoms as well. They will come out and also listen to the heart and all that to come out of what most possible on the first and the second. And then they treat accordingly. Okay, so usually we need to use antibiotic because it's an infection. Okay, even if it is a viral infection that we're treating, we're worried about secondary bacterial infection. So we will always cover them first with antibiotic. Bronchodilator like Nulin and all that some people say, because it's open up the airway. Like I told you, because of the inflammation, it's so much more smaller. Now they need to open up. So then they want expectorant. Expectorant means they want something that can actually bring out the phlegm and actually cough up. All right. Anti-inflammatory or in severely inflamed or fever patient. Like I told you, like just now you really hear the sound, the lung sound or different lung sound on this pneumonia. Okay, usually with the stethoscope, your vet will be able to tell you. Okay. Supplementation of oxygen when the lung capacity is really low. Okay, to be frank, now you can actually get oxygen concentrator very easily from Taobao, even online thing. It's an oxygen concentrator for human use and even for animal use. And because of this COVID, right, I think the demand is so much higher. They come up with much simpler machine and cheaper machine to work with. It's actually a very easy working machine, just like an oxygen concentrator. Is they just concentrate whatever oxygen that is there, put up with some water because they need to moisture it, and then push it out for the animal or for human. You can actually use the human oxygen concentrator for your dogs and cats too. All right. Fluid therapy, usually when they are really having this, right, sometimes oral medication will take some time. In some very severe cases, we put them on IV drip, and then we give the antibiotic into the in as well. All right. And then definitely, because it's an infection, you can actually go on immune booster as well. Okay. Oh, I just realized Joey actually put a DFG there. Pandai dia what at. Okay, what should you be doing? What should you be doing? So when you know that your dog is having pneumonia, restrict their movement. A lot of water if you can, and then oxygen supply in severe cases. So you can put oxygen concentrator, put a mask like that, and put it on. Okay, one tips for you guys. Usually, right, the nebulizer or the mask that actually comes out from the human nebulizer or the human oxygen concentrator, right, is those flat one because it's for human face, right? For doggy face, then what we do left? What you do is you can modify it with the bottle, like Tom small dog, right? You can actually use the 600 ml mineral water bottle, cut it into half. One side of it, the narrow side, put the oxygen tube in. The other side is keep it nicely, so that it doesn't cut the side of your dog's face. And then after that, put a rubber glove on it. Put a rubber glove. Put a small hole on the rubber glove. Then you stuck your doggy's face inside through the hole of the rubber glove. Then whatever oxygen that is go into the half of that mineral water bottle will actually become the oxygen chamber, oxygen mask like this one. Okay, it's difficult to buy this one. It's very expensive. Even though you have the money to buy, right, it's quite difficult to buy because we don't really have supply here in Malaysia. We usually buy it from overseas. So sometimes ours is spoiled, so we have to like repair here and there because it's very difficult. For bigger dogs like lab and all that, you can actually use the bigger 1.5 liter bottle. Okay, do that. And if you really can't and your dog don't like to be like that, what you do is, the e-collar. This one I need you to pay attention because this is the tips that you really can do. The e-collar is like that, right? So what you do, you put a transparent film, like you can actually use the paper, the wrapping paper that you keep the food fresh. What is it called? Alamak, nampak sangat I don't cook. Cling wrap, yeah. Cling wrap, but not the aluminium one. It's actually the transparent one. So use the transparent to cover the collar. So the collar go this way, you color on top, and then you put your oxygen tube come out from here. The transparent plastic, yeah, correct. 保鲜膜, 对. So you put the tube over here from the e-collar out here to be near to the nose, and then you cover it that way. But make sure if you are doing that, you open up some holes for ventilation. Okay, if it really is severe cases, this is what you need to do when you are at home. Okay, in some cases like not only pneumonia, in some cancer patient that they don't want to keep in the hospital to look after, they want to be at home, and then they want them to pass at home, right? Then if it is all the cancer is all metastasized into the lung already, that means all goes to the lung already, then they will have less lung capacity to work as well. This is something that you can do instead of putting them in oxygen cage. All right. You guys can understand, right? If you can understand, put 99. Okay. And keep other pets and children away so that they don't play with each other. Because why? Because already cannot breathe properly. Then you lagi want to exert them, then they collapse off because not enough oxygen capacity. Okay? Good. Great. Next. Okay, what is pulmonary edema? This is also something that this is the last disease I'm going to share. So bear with me. I know it's 9:30 already almost. So pulmonary edema meaning there's this buildup of fluid in the lung. Okay, imagine lung as the sponge, like your washing sponge. Okay, so it's supposed to be filled with air and be used. Okay, if it's filled with water, means it cannot be used anymore, because if filled with water, it cannot fill with air. And when it's filled with air, it has oxygen for your body to use. If filled with water, you cannot. So generally, pulmonary edema meaning, right, like the lung has fluid, then what the patient will feel, what the human or the doggy will feel, is actually like drowning, like you are being put inside the water and drowning like that. Okay, so the lung sac will fill with fluid instead of air. Any kind of fluid. Sometimes pulmonary edema is one of it. Sometimes in accident cases and all that, right, that sac is actually filled with blood instead. That is also we call it hemothorax, and the thoracic cavity filled with blood and all, or even a hemorrhage, that means they bleed into the lung. It's also having problem that store oxygen or use the oxygen. All right. Okay, let's see how does pulmonary edema, what is the cause? Okay, like I told you just now, it could be trauma. All right, trauma can be blood, it can be lymph, that means lymph fluid. It can be exposure to toxin. When you expose to toxin, the vessels, right, the blood vessels actually goes haywire. They actually cannot allow all this water to go out one. And suddenly they kind of open gate like that. They open gate, all the fluid in the vessels that's supposed to be fluid only, the fluid actually go out of the pipe, the blood vessels. So imagine the blood vessels is a pipe that only allows certain things to come out. Now what happened? The toxin make this pipe full already, so they open up the gates. So all these smaller particle stuff like fluid will come out of it. Okay, so when they have when they expose to toxin, they will have this. Third thing is actually the cardiovascular disease. That means either heart or circulatory disorder, meaning to say that let's say you have heart problem. The most common one is small dog. I know all of you. I mean, most of you have small dogs, right? Or some cat. In this heart disease that is very popular in small dog, not popular, very common in small dog, is that the valve of the heart is not working properly. So imagine if the heart is not working properly, heart valve is not working properly, every time it pumps out of this blood, it will be a backflow. So imagine you need to pump out 100% out to the whole body, and now you can only pump out, let's say 80%. Then your body very smart, right? I need 100%, like give me 80, why cannot don't have enough. So what you do? Tell the heart, pump harder and faster. So when you pump harder and faster, what will happen? The blood pressure goes higher. And when the blood pressure goes higher, it goes to the whole body, good luck, because you have enough for the whole body, Lima. Then the other side of the heart pump to, where do they pump to? Come, tell me in the chat. Otherwise, you're all fall asleep, Edie. Tell me, the other side of the heart pumps to where? One side pumps to the whole body, the other side pumps to where? Tell me. There are two sides of the heart, right? One side will pump to the whole body, including the brain and the whole body. The other side pumps into the lung because it pumps to the lung to actually get oxygenated, ma. You forget already. So you goes to the lung, take all the oxygen, become the red color blood, and then come back into the heart, then it pump out. So after outside finish using, right? And when it comes back to the liver, blah, 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 and then come back, no more oxygen already, use up already. So what they do, then they get pumped up to the lung again, get oxygen, and then pump back to the heart. All right. So that's how the whole thing goes. Okay. When you come for the CPR class, you'll be very clear because I'll come up with the, diagram to show you how it works. Okay. So this is what it is. So when they actually pump harder, it's enough to go to the whole body. So what happened to the lung? It has so hard, the pressure is so high and all that. All the vessels, you have high pressure, ma. Outside is the lung, which is the sponge. How high can it be, right? It is soft. So whatever things that is being pushed out is the fluid that actually goes to the lung. This is generally how a heart patient will have this water in the lung. Well, some tompang, oh, got fire up, sorry. That's the thing. So it means that, oh, you have heart disease. That is why you actually have pulmonary edema. Pulmonary edema is a beautiful name for water in the lung, something like that, or fluid in the lung. Okay, next. All right, so usually because they have this, right? They also won't show you in the start, okay, won't show you in the start. Whatever symptoms that I write here, right, it was starting to have, I always like to take Christy as the example because I think she's so amazing to detect that. You imagine her vet actually show her beautiful X-ray one day for on how beautiful the lung has become because they have heart problem. So beautiful, oh, very beautiful, can reduce medicine already, okay? 2 days later, I think only 2 days or 3 days later, maximum 4 days, she texts and say, Doc, Cham, the breathing rate is higher. Okay, none of this thing is happening. No abdomen bleeding, no sitting up, no bluish, no stand up, head up. It's only increase in the respiratory rate. I think it increased up to almost about 40, I think, 40 plus. I say, hey, cannot already, you must come. So she showed me the video. I said, hey, you must come. Then I really remember what she said. She said, doctor, no appointment. Then I was like, F the appointment, come in tomorrow. Come in tomorrow, we actually do the X-ray, right? Already have pulmonary edema. So we can't even use oral medication. I remember we use injectable medication. We use injection, so that he can pee out the fluid. And actually, Christy saved her dog then because of her observation on how the breathing looks like. Okay. And then when it gets really, really bad, if the breathing, now it's just increase of breathing rate. Then after that, because it's so filled with fluid, wow, you increase breathing rate also cannot already. Then they start have abdominal breathing because like I told you, the lung cannot work, then the abdomen come up. The abdomen come also cannot already. So what they do, they try to stretch out, stand and head up because they think they open this one, the air, more of the air will go in. And when they do that, because whenever they pump the blood to the lung, they don't have oxygen, that push in to come back. The oxygen level of the blood that coming back becoming lesser, then only you see the bluish or the purplish tongue. Okay? And by then, you probably will have less than half an hour to come to the clinic. And even then, with the bluish and purplish tongue, to be very, very frank with you, even in our practice, with that, I think even with the oxygen and all the injection that we can push out, right? I think that animal probably the most can survive half a day. And it's that bad. Unless within that half a day, the thing is so, we are lucky enough to bring out at least 30-40% of the amount of water that is in the lung for the dog to survive. Okay, so most of the time when you say they collapse, get up, they collapse, and then they just go. Or when you send to the vet, within half an hour they go. It's just too late. All right. So these are the symptoms that you know, but all of this is when it's really bad. Okay, so later on, you don't really have to pay attention so much on this. I'll teach you how to do the resting breathing rate. Okay, next. So what we do is we remove the fluid usually by orally when things are not so bad. So it's a coughing, oh, we hear, then we actually, see some of the patches. Okay, we give you oral medication. You go home, take the medication, urine a lot. Oh, better already. Or eat some heart medication or even, blood pressure medication. But usually we'll find out the underlying cause, whether like just now the trial, whether it's toxin and all that or not. In some cases, we also put on bronchodilator and definitely oxygen supply. Most of the cardiac patient, if it is like really sick heart patient, what we do is we do cage rest. We call strict cage rest, meaning to say that they can only be inside the cage, nowhere else, because no exertion. But when they're inside the cage, they keep jumping out and ask to come out. That's not cage rest. Cage rest means they should be in the cage, don't move. So in the cage, maybe with some oxygen and things like that. If they move, they see you, they move, you cover it with towel with the oxygen supply. Can as well. Okay. Resting respiratory rate is something that I'm going to teach you later. And then the application. We'll be showing you the application. This is it. Whoever, last time during the heart talk, right? I think I teach you guys before. Anyone has actually downloaded and used it? Anyone has downloaded and used it? Great, very good. 很听话哦. Very good. Good. So when you do that, right, you set the 15 seconds. So download this app, whoever that is on. I'm not related to this particular company, but it's just that download but not sure how to use it. Okay, so I'll tell you how to use it. So after you download this app, right, this is a step on how to use it. Okay, this Chelsea, I put on Chelsea's one. I just screenshot this. So what happened is you put the detail first, and then after that, it will tell you that how many seconds you want to check. So I would encourage you to check with 15 seconds because after 15-20 seconds, you will lose count of what you want to check already. So usually 15 seconds. You put a 15 second, and when you press start, right, every single time the chest go up and down, consider one time. Up, down, one time. So you see up, down, you tap one time. See up, down, you tap one time. Tap, tap, tap. So you don't have to look at your clock. Don't have to. You just look at the chest of up and down and start tapping following the chest. Okay. After 15 seconds, it will come out with it. And then after a while, right, you need to do it when it's called resting respiratory rate, meaning to say that is sleeping and all that lah. Okay, so usually like what you guys tell me, 15 to 30 is the best rate. Okay, so you will know. I purposely do some of it during a vet visit and during, after playing with him. So I get, so usually when he's sleeping, it should be around 20 over breath per minute. Okay? Yeah? Clear? Great. I think we're almost there. Great. I think we're done. Question. If the question that I need to KB, I think we answer your question already. Whoever that hasn't answered the question, you can repost it here, down here. So the normal breathing rate, we already tell you, did you get it, Catherine? How to measure and what's the normal? Great. Oh, Christy just now replied to me, it was only 2 days. The last we checked the lung beautiful for 2 days, and then she tell me something is wrong. Great. Proud of you, Christy. Right. Honking. Only honking and wheezing in the morning considered trachea collapse. Actually, trachea collapse, right, can be transient. So what happened is sometimes when the irritant is there, it just collapses for one and it come back. Some transient happens like during the irritation is there. So sometimes you have to be very careful on your nebulizer lah, your what is this called, your sanitizers. Sometimes even some people use essential oil and all that. Have to be careful. All right. Kennel cough don't pass to human, no. Taco don't have to already very good looking. Don't have to be good looking to impress the vet. You're right. Just now I've done this. What else that I didn't do? Does overweight, I also told that already. Okay, how to differentiate panting when anxiety to breathing. So you usually, when we see that whether they are difficulty in breathing, right, or having problem in breathing, is when they're resting up. So if they are being, having anxiety, seeing new people around them, coming to the bed and all that, is definitely not. So that's why I'm telling you that you should be the gatekeeper for your own dog, because when it comes to the vet, it's a totally different story altogether. All right. So if you see them coughing and all that, please video it and show it to your vet, because sometimes things that you don't pick up, your vet can actually pick up. Okay. What about snoring? Okay, snoring usually happens when the soft palate is a bit long, or it's a bit how to say, it's a bit collapsing, then you get snoring, or because of the nostril is too short. So that's in the world, there's a movement of asking people not really to have a short snout dog like Park and Frenchie and all that. But when whoever that has it, please don't throw them away. Okay, and then that's it. Snoring usually don't cause problem unless usually don't cause problem if they only snores when they sleep. Sometimes it's because of the relaxing of the muscle, and also sometimes because of weight. If your dog is a little bit overweight, maybe try just reducing the weight first. That should be the first line to help the dog not to. Okay. Okay, great. I have actually screened through all. So healthy breath for all dogs is usually about, yes, 15 to 30. Some very large dog like Doberman and all that sometimes can be about 10 as well. It's still normal. 10 to 30 is still normal. But let's say your dog baseline is always around 30, 35. Then it's okay, Lord. That should be her baseline already. But normal dog without, previous scarring and all that, right? Usually is about 15 to 30, okay? How can pneumonia be detected by X-ray? Usually, like I told you, pneumonia, the dog very sick, ma. So usually the mother, the parent, the owner knows it first. Okay? The owner knows it first. Okay. Wendy, raise your hand. Anything you want to ask?
Yeah, doctor. We have a member here, right? His name is Ben Ben. Then one day he was playing with us, and then he get very excited, and then start barking, and then instantly his tongue changed to purple. We don't
Right.
know what happened, and then we don't know whether is it trachea collapse or anything to
So
do
he
with
just
it.
barked. He just barked and then
He
he turned
fiercely
purple.
bark at us because he kind of like angry, and then he fiercely bark at us, and then the tongue instantly changed purple. All of us got scared.
Then what do you do?
How we just calm him down. What can we
Yeah.
do? We don't know what to do. That's why I'm asking. I think Catherine is here.
Okay, first of all, what you do is right that you actually calm him down first. The mother has to calm him down, not the person who irritates him, right? That's one. And second thing, when they are having that, right, most of the time is because the trachea is having a little bit of issue, or either the trachea or the bronchus has a little bit of issue, then they turn blue so fast. Actually, I think Paco also having the same problem. If he really kanchiong, then he turn blue. So even when we're stretching the neck a little bit to take blood, they also turn blue. Most of these cases that actually have that has an airway issue. So meaning to say that the man might be having some airway issue. It could be airway issue. It could be also heart issue. But most of the time, some very mild heart issue can do that when they exert. Okay, so when they don't exert, they're fine. If really that happened, let's say he just keep barking non-stop, so mommy bring him to a place that calms him down already, then he's still a bit purple. If you don't have oxygen with you and all that, first of all, is the fan. Second thing, if you don't even have a fan, just keep blowing near the nose. Just blow like small blow of air near the nose. Okay, close the mouth a little bit, then blow into the nose. Not to say that blow into the lung, because if he really, really collapses, that means he's blue, and then suddenly because of blue and then no more oxygen in the brain, then they collapse like syncope. Some heart patient will have that when they collapses, right? Then you do mouth to nose. How to do mouth to nose is you use your whole mouth to cover both the nostril and start breathing into it if you don't see any breathing. Okay, if you still see breathing, you just blow outside, just blow on the nose. Pull out the tongue, blow near the nose only. If it's so purple that you don't even see up and down, that means no breathing, right? Then you have to cover your whole mouth with the two nostril and start breathing in. Like all of you said, right? Remember, 15 to 30 is the rate now. So you do 2 seconds one time. What is 2 seconds? Not 1, 2. No, 1, 2 is not 2 seconds. It's 1001, 1002 is 2 seconds and blow. 1001, 1002 blow. 1001, 1002 blow. Okay, that's the first aid that you need to. Yes, Catherine.
Doctor, actually, Ben, he is when we try to like tell him he's naughty, you want to beat him, right? So we just put the flip next to him. Then he will like very kanchiong. Then he will start to bark. Oh, sorry, can you hear me?
Yes, I can.
Oh,
I was like, why do you do that? Okay, never mind.
Because sometimes you want to train him, right? So he will try to bark, and then the more he bark, he get excited. Then he has started to breathing problem.
Yeah.
That's how we identify. We are assuming he has trachea collapse because I brought him to a few doctors. They said he has, but he don't. If normal thing, if he runs around, he's okay. It's just that recently, like for the past few weeks, this morning he started a bit of painting, like you can know that there is something not right, but it's not really that severe.
I would suggest X-ray is the first thing to go. At least you want to rule out whether it is the trachea issue or the lung issue. That's one. Second thing is he big size? Is he
No,
overweight?
he's very small. He's 2.5 kilos.
2.5 kilo, a small one can be overweight too. I have
Okay.
found that it's
Normal size
1.5 kilo and it's overweight. Ah,
Oh my God. Okay, it's not that small.
it's not that
I think so.
overweight. Okay. So in that case, right, it could really be the windpipe that is having problem. Is either some irritants that cause that. But when he is barking, right, because when he's barking, he keep pushing the air out. And when he has to do that, right, then it irritates the throat. I mean the trachea. And by doing that, the trachea can reduces in 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 size, and that could actually give you the purple color tongue lobe. All right. So when he's not exertive, from the X-ray, you might not be seeing the trachea collapse. So what
Okay.
you probably need to do is first, you don't irritate him first. Second, not only the irritation, physical coughing. Second thing is antihistamine and all that might make sure the normal inflammation doesn't go on before this thing happened. All right. So the more he cough, the more irritated he'll get, then the more collapses that trachea can be. But when he's coughing, when he's barking, can you also hear the coughing honking sound?
No honking sound. No. When he barks, no, he doesn't have
Like
that.
that?
When he barks, he just barks. It's just that when you see, because we used to train him, and I don't hit him. It's just that I use the training stick and just put near him, and then he get defensive, or he get panic, or he doesn't like it.
Yeah.
So he will just get annoyed. Then he will started the
Mm.
irritation.
At the
Then
moment, it's not a good thing to do to him now, lor. It's not good
okay,
to
so
do
that,
now.
but yeah.
Until you get this one sorted, that is one. And second thing is because when he's coughing, right, he's using the same place. So when when he's barking, he will also have lesser air to go into him. It's good to check his lung, his heart, and the trachea. So go to your vet and tell them.
Actually,
Alright.
I've seen few vets, but they actually just I would suggest I will pop over to meet up with you with Ben. I think that would be better.
Right. Okay,
Yeah.
great.
Okay, thank you.
So, any more question? Okay, 5 more minutes and then we close 9. Great. Actually, what happened is that if you guys are a member, right, you can actually access all this video in the membership site. Okay. Okay. Let's Pangju, we have something for them to see so that they can join, right? Okay. You can just take a snapshot of this thing, the Go member, and I think the Go member can access to one video, I think. And then the platinum member, because of time issue, you can just take a photo of this and then you can join later, okay? The next one, this is the one that actually you can access in the membership site. All this video will be uploading there as well. Okay, great. I think that's all for today. Let's take a photo and ciao.